I'm indeed privileged to chair this meeting. My name is Danjuma Adda. I am the president of the World Hepatitis Alliance. And as you probably know, the World Hepatitis Alliance is a global international network of membership-based organization in over 100 countries with over 300 members across the world. And we are a group that drives advocacy and awareness about hepatitis, and especially amplifying the voice of people with lived experience. So thank you so much, everyone, for joining the call. I indeed look forward to a very beautiful and interactive meeting. So we are looking at the World Hepatitis Day. This is a webinar on community forum. And just to give you a background to this, this is for a series of activities to mark World Hepatitis Day. And what we're having today is a community forum. And the community forum indeed brings together different people from across the world. We have panelists, we have experts, and then you that are joining the call, you are equally very important part of this discussion. So to give you a background to this very important event, viral hepatitis, as you probably will know, affects over 350 million people worldwide, and majority of people testing and treatment is beyond their reach. Many people are undiagnosed. Many people that are diagnosed do not have access to the care that they need. And that is why the World Hepatitis Day Community Forum will give a real insight into the many experiences, the perspectives, the unmet needs of people diagnosed with and living with hepatitis across the world. We're bringing a diversity of people with lived experience of hepatitis from different parts of the world to share experiences of what it is to live with hepatitis and then accessing care. So we have a panel of very great experts and people with lived experience, and also people with scientific knowledge and background. And the experts will share and explore global conversations around eliminating hepatitis by 2030 and why we are not waiting for hepatitis elimination. Remember, as WHO, our goal is we can't wait. We are not waiting. So the forum will open up space for people with hepatitis to share experiences and offer possible solutions to address challenges as a result of this pandemic that affects over 350 million people across the world. So I'm indeed privileged to join an array of very great speakers on the panel. But before then, I would want us to run through some housekeeping on this meeting. So this meeting offers simultaneous interpretation, and the interpretation goes into different languages. So to listen to original audio, please select original audio from the interpreter button below. You will see original interpretation. You click on it, and then you click on the language you are very comfortable to listen to. So for English members, select English. When any French-speaking participants are talking, that would give you the translation or interpretation into English language. Then after the panel discussion, we're going to have question and answers. Then we have discussions, and we would want you also to share your experiences. That is you that you're joining as panel members. So it's going to be an interactive meeting. It's not going to be just top buttons, people speaking, but it's going to be interactive. We want to hear from you. We want you to share your experiences. We want you to tell us what it is about accessing care and challenge of hepatitis. So to kickstart this, I'm going on right now to the panelist introductions. Without any order as to any order as to who is speaking, but I'm going to just call on the panel members, and they will now introduce themselves. Then we go on to the presentation. So I will start with Shabana. Please, a brief introduction. I think you are muted.
Unmute. Hi again. Good afternoon, good evening, and good morning, wherever you may be. My name is Shabana Begum. I presently work as a South Asian project coordinator for the Hepatitis C Trust, and my post is national-wide. I am also expert patient. I have lived experience with hepatitis C.
Thank you so much, Shabana. We're indeed privileged to have you. I so look forward to your presentation later. So I'll go on to Leanne.
Right, thanks, Danjuma. Hello, everyone. Warmly welcome to our community forum this year. My name is Lien Tran. I'm from Vietnam, but currently living in Australia. I'm a proud mom of two, living with hepatitis B. I'm currently the regional board member for the Hepatitis Alliance, representing the Western Pacific region. I'm also a researcher at the WHO Coordinating Center for Hepatitis at the Doherty Institute in Melbourne, Australia. Thanks so much for joining.
Thank you, Leanne. Indeed, WHO is privileged to have you as our regional board member. Aftab?
Hello, everybody. It's a great pleasure to be part of this very important community forum. I have joined it for the first time. My name is Dr. Aftab Ahmed. I am from Islamabad, Pakistan, and I'm serving as president of National Academy of Young Scientists in Pakistan. That's a network of young researchers in the country. I'm also a scientist member of World Economic Forum, as well as World Science Forum and few other forums. And in World Hepatitis Alliance, I'm serving as a future global leader. So this is a unique experience for me. And hopefully today we'll discuss our stories with you, which will be like very inspiring and interesting for everybody.
Thank you, Aftab. We are so glad to have you as one of the board members there. So David?
Hi, everybody. My name is David Urich. This is my second year participating in the community forum, and it's my privilege to be here again. I'm from Michigan in the United States, and my lived experience has to do with hepatitis B. I was born with it and diagnosed in my adolescence, and I'll be talking a bit about that experience today. And I'm currently serving as a board member on the National Viral Hepatitis Roundtable, and really experiencing a lot of growth and learning from my other fellow members, and it's been a great experience so far.
Thank you, David. Joshua Bartolome? You're muted? You're muted?
Okay, hello everyone. I'm Joshua Pacaira from the Philippines, a member of Yellow Warrior Society Philippines, a local organization in dealing with community with hepatitis B and C. Currently a community organizer under the University of the Philippines. This is my first time to joining this kind of event, and thank you for inviting me and giving me opportunity to participate in this event. Thank you.
Thank you. And last, and by any means not the least, we have Anton, who brings in also a great wealth of experience. Thank you, Anton.
Yeah, thanks, Danjuma. Yeah, nice to meet everyone. My name is Anton Pasenka. I'm originally from Ukraine. I'm a person living with HIV and been diagnosed with HIV and hepatitis C at the same year, 20 years ago, because of absence of harm reduction programs and reality of unsafe injecting drug practices. I'm also a person who uses drugs. And today I'm speaking as a program manager of European AIDS Treatment Group and also chair of the board of the International Network of People Who Use Drugs.
Thank you, Anton. You quite bring in a lot of rich perspective to us. So colleagues, friends that have joined, as you can see, we have a great array of panel members to share experiences. I'm so excited that this is the second year that we are having this, and I indeed look forward to these beautiful, rich interactions we're going to have. So just to give you a heads up, we're going to look at the different topics. We're going to listen to the panelists. So the first person that will go would be Aftab Ahmed, and Aftab Ahmed is going to share with us experiences from Pakistan. And after him, we're going to have Lien. Lien will tell us about improving care and treatment in primary care. And then we have Anton. Anton is going to share the very rich, diverse perspective about HIV and hepatitis co-infection. And let us not forget the fact that the global health sector strategy now talks about integration. So how do we have, what are the issues around the challenges or the barriers or the successes about integration of hepatitis into HIV and AIDS programs? Then Shabana is going to share, David is going to share with us young people, mental health and advocacy. David is a very great voice in hepatitis advocacy in the United States. And we have Shabana is going to tell us about hepatitis C and South Asian communities. And Bartolome will share with us advocacy and experiences in the Philippines. So these are the key topic areas. And I just want you to please sit down. If you want to take note, and then jot down your questions. And at the end of it, we're going to have question and answers, and we'll definitely want to get your perspective as well. So we're going to set the ball rolling with Aftab about the experiences from Pakistan. Aftab, the floor is yours for your presentation. Thank you.
Thank you very much. And I'm really happy and excited to see that there are participants from across the world, from different regions, speaking different languages, but we are all together here to learn more about hepatitis, which is a growing global pandemic. And, you know, as mentioned in the start, that there are around 350 million people. That's a huge, huge number who are suffering with hepatitis in the world. And unfortunately, Pakistan is a region which has one of the highest population of people with hepatitis B and C, and around there are roughly 13 million people in Pakistan who are suffering with both hepatitis B and C. So it's a big problem in our country. Because this is like a community forum, so we wanted to share our own experiences that what we have gone through. And I really appreciate the World Hepatitis Alliance, because they have focused and they have the members who have their own experiences of going through the disease and the treatment and everything. So that's actually gives you more motivation to bring awareness among the communities and this is what I have also done myself. So I was not aware about hepatitis B and C until I was like, that was my 12th grade, and I wanted to join a medical college in Pakistan. So for that was actually related to Army. So for Army Medical College, there is a need that you have to go through your physical examination and to your other all health related examination. So like I was happy and I didn't have any problem. And that's actually true with the hepatitis, because more than 80% cases, that's actually silent. They don't know about the disease, although they are suffering from the disease. I mean, the infection is there in the body, but you don't have the symptoms. So that's like, around 23 years ago, when I was like, I went for the medical checkup, and then I came to know that I am diagnosed with hepatitis B. And that was like, I was totally shocked that, oh, what kind of disease I have. I was diagnosed, my family was so worried. And like, I still remember that when I told the story to my mother and my sister, and she was like, she kept weeping for hours, that like at that time, everybody knows that if you're suffering from these diseases, people were dying on daily basis, and they were very much afraid that I have like got the connect infection, and that could be a serious problem for me. So that was actually the start. And then I went to, I didn't join the medical college because I was diagnosed positive for hepatitis B. And then I joined the microbiology program in one of the leading university in Pakistan. And that's where I started investigating about hepatitis B and C and how we can like raise the awareness among the community. Because at that time, I was not aware, my family was not aware about the disease. And like there was a lot of false information, like people you go to some rituals and some kind of things, and if you do this and eat this drug or eat this herb, then you will be cured. So there was a lot of misinformation. So I just wanted to share the scientific information. So I, like during my BS, for my research work, I focused on hepatitis B. So because I was suffering myself, so I thought I should like do something. I started working on preparation of hepatitis B vaccine in Pakistan. So we can provide a better quality of the vaccine. So like there was already like vaccine is available about hepatitis B, but I was trying to improve that vaccine so that could be more effective for the people. Even like my target was, if you are having the infection, still you can use that vaccine because on one side, if you are not infected, that will actually provide you immunity. And on the other side, if you are infected with the virus, then that will help you to better cure the disease. So that was in my mind. So I started working on hepatitis B vaccine. That was like my BS thesis in the university. And later on, I got the opportunity to move in the United States. So I joined another institute in California, where I started working on hepatitis B and C. So at that time, I was like working on on multiple approaches. On one side, my focus was to develop a more effective vaccine, joining the surface antigen and the core antigen. So that was in my mind. Another was like, the other thing was at that time, interferon was used for the hepatitis B and C treatment. So I thought I should like work to have a better interferon. So I started working on different formulations. So at that time, that was like a new technology, and I love to work on those technologies. So I used to make different chimeric proteins. So chimeric protein, for those people who are like don't have the idea, so these are the protein in which we join different proteins which have the role in the treatment. So I used to make like interferon with the thymosin and interferon with more glycosylation, so we can have the more life of the interferon inside the body. So like that is my motivation, that when you are suffering from something, you try to find like the cure of that disease. So I kept working in the United States, and then I moved back to Pakistan, and I continued my effort for a better treatment. So we were running the trials, and we were trying to make some like better combination of the drugs we can treat the disease. Meanwhile, you know, there are like now hundreds of companies which are working on the treatment of both hepatitis B and C, and now we have like very good treatment available, especially for hepatitis C. We can cure more than 95% of patients with the latest drugs which are available in the market. So that was my starting point. When I came back to Pakistan, I thought I should provide the awareness. So I started writing a book in Urdu language about hepatitis C, because we have more patients of hepatitis C in Pakistan. So I published a book in Urdu language, and that was published by the government of Pakistan. So I'm really excited that like that's my contribution, so people could be aware about the disease. And later on, I also started working on hepatitis B and C. So with the help of other medical professionals, we started writing books on hepatitis B and C, which are also available online yet. So people can also go through those. So we actually, in all those books, what we have done, we try to address the very basic questions which comes in the patient's mind. So like, if I get the infection, what should I do? Should I remain separate from my family, or what kind of like things I can use, or what drugs are available? So addressing all those questions. So our focus was like, we should address those questions. So we produced books, and then we had another network, just like I mentioned in the very start. I was the founder of Asia's first National Young Academy, that's National Academy of Young Scientists in Pakistan. So we have a very good outreach.
You
the
have
books.
You have 1
Sorry?
minute left. You have 1
Okay.
minute.
Okay. So we actually had a very good outreach in our whole country. So what we have done, we published the book. We used to put at different places, like in the hospitals, at the bus stations, in the train stations. So like everybody can grab those, and we publish for free for the community awareness in Pakistan. Besides that, we also used to arrange different seminars, symposiums, workshops in the whole country, so we can raise the awareness to the maximum community in Pakistan. Right now, the situation is right now we also still have more than 13 million patients in Pakistan. And despite all the efforts, still there is a need of a lot more awareness, because the number is still increasing in Pakistan. That's really unfortunate. And that's why we have to put more effort so we can provide like better awareness and treatment. Because the major problem is, like, as we know, that 9 out of 10 people are unaware that they are suffering from hepatitis. So that's why we should have to like have a very good campaign so we can aware those people. So we should go for testing so we can start the either vaccination or the treatment.
Oh, thank you, Aftab. I mean, quite very rich experience, and looking at both the clinical scientific background and then the work in finding functional cure, that is quite interesting. So I'll come back to you maybe later during the discussion about what you think is the future of functional cure, especially for hepatitis B patients. Now, before I call on the Lien, I need to say also that I live with hepatitis B, and I was diagnosed way back in 2004. Quite challenging, quite a big trauma when you are told you have a disease that has the possibility of you developing liver cancer. And for me, it was at a very crucial moment when I met then my wife-to-be, who is currently my wife and the mother of my kids. and you have challenges of high stigma in the community because people think it is morally bankrupt people. I mean, people allude infection, bloodborne or sexually transmitted infections to character, to behavior. So people think you can't get hepatitis outside social contact. So quite challenging to disclose titles, quite challenging to work as a healthcare worker in the hospital, where you have the fear of maybe transmitting the virus to patients or to co-workers. So, and then you have out there, you have healthcare workers who probably do not have solutions or even the right messaging. I know for hepatitis B, I remember that time, each time you go and meet the GP or the gastro, they tell you, it's difficult, it's complicated. There's no solution for now. And these are the people you're looking up to for help, and yet they're telling you there's no help. So usually people now resort to self-help, but I'm grateful for the fact that what I decided to do when I was diagnosed is to really understand the science behind it, and not just to trust on Dr. Google, because a lot of folks, they rely just on Dr. Google and not real clinical guidance for hepatitis management. And I remember when I started my charity, it was quite challenging, no resources, and there's still no resources for hepatitis, most hepatitis patient groups. And just started with the peanut of salaries, get the salaries, go and buy test kit, mobilize healthcare workers. We go to communities, we do free testing, and we go to communities, do awareness creation. We try to bring in more civil society, but there's nothing appealing in hepatitis. There's no funding, no money for hepatitis. So even civil society folks were not even interested to join the campaign, because literally they have to use their own resources to do activities, no grants. Just quite challenging to start, very challenging to even build networks, build civil society networks, because nobody was interested, because there's no money in hepatitis, no funding, no financing. So literally we have to rely on salaries, income to buy reagents, buy test kits, go to communities, go on radio program, and quite challenging journey over 15 years back. And looking over the years, I think, well, we have made attempts to move the needle, but the problem is still huge. For example, in Africa, 0.1% people have been screened and are on treatment, 2% have been diagnosed to know their hepatitis status. And many people are not ready to even come out to share their story. So that is a part of my own personal story. And it's quite challenging. First Nigerian Summit in 2018, we couldn't have patients to share stories. Nobody was ready because of stigma. People were afraid to come out to share their stories. And we are just hoping that now with more information, people should be able to be empowered, to be happy to share their stories. And that will really give more motivation and, help other people that are not, that maybe are living in fear to come out and share their stories. So we move on to the second panelist, Lien. Lien is going to share experience of misinformation of diagnosis. And then Lien is a researcher and also a board member at the World Hepatitis Alliance. Lien, thank you so much, and the floor is over to you.
Thanks, Danjuma. Thanks, Danjuma and Aftab for sharing your thoughts and sharing what you have experienced in these spheres. So I just want to echo that actually happened everywhere in terms of sharing the stories, personal stories. So actually last week at a conference in Brisbane, Australia, we got a question from a nurse in Australia talking around in her area. So it was really hard to get people to speak up because they are afraid of stigma and discrimination. And it was so hard to get community movement, to get community leadership, just because no one wanted to talk about that. And she asked what I thought would be enabling point for that to happen. And actually I thought of two things. One is around that the whole society, legal and all other social aspects, we need to be able, we need to have, and I think we are responsible for creating an environment, a safe environment, that sharing those stories will not impact the way that they live, the way that how they are in the society. And then secondly, I really think that's also from my experience as well, from listening to others speaking about that, that was an inspiration for me to start talking. And I really hope that if we all do it, then we will actually create a network of people, a network of strength, of bravery that people will go and share, and together to take leadership in the responses. I'm so proud that I'm saying it now, that I am sharing my stories, but it was not like that many years ago. So I was first diagnosed with that when I was first year at university, and by that time I was awarded I was in Vietnam. I was studying in Vietnam back then. So I was awarded a scholarship to study overseas, to study in Europe. That was a really big deal for someone from northern Vietnam, from a smaller village, and from someone who just left the village to go to the city to do her university. But then, as a part of the paperwork, I had to go through a health check for everyone who had the scholarship. And then the doctor at the testing service told me that I had hepatitis B, and because of that, I would not be able to go overseas. So by that time, I had no idea about hepatitis B. The only thing I knew about that is it is something related to the liver. And because my grandmother died of liver cancer, so I thought actually I was having cancer. So I didn't doubt what he said, and said to the uni that I was attending that I would not accept a scholarship without telling them why. I just thought I should not tell them that I think that I was dying. So I did not tell them, and then I went back to study at my uni. It was by that time I didn't want to tell anyone, so there's a lot of reasons, but I'm glad that now I'm sharing it now, because I think it's great that I have finally felt that I'm less stigmatized myself, or less guilty of living with Hep B and doing that. So at times I think of hepatitis B as my family heritage, because my mom lives with hepatitis B, I live with hepatitis B, but then luckily that heritage stopped, and me and my two children are free from hepatitis B. So I think that is a point that I also want to tell everyone, that you can live fulfilling life if you follow the advice. So because of that, so we Danjuma, how many minutes do I have left? Yeah, so we moved to Australia 8 years ago, and then I have been able to start working in the sector, start supporting people with our online support group for Vietnamese living in Australia, and joining WHA. And then I think this is a really rewarding journey, and I really, really hope that others won't be given such opportunities to talk about that, to feel that they are living a fulfilling life and they are thriving. Yeah, thanks everyone.
Thank you so much, Leanne. I get really inspired and touched with your story each time I listen to it. And you can imagine the number of people out there that also had to stop their career decisions because of the fear of dying of liver cancer. And I remember, Leanne, when I had the hepatitis B, 1-2 years after, I'll always stand in the mirror, I'll palpate my liver. Is my liver, I'll check my eyes, am I already having jaundice? Am I already having liver cancer? So yeah, these are fears people would always have, and thanks for sharing. Now, we're going on to Anton, and indeed is bringing quite some good, rich perspective. And Anton, before you share your story, I was wondering, also curious to ask you, because we have a lot to learn from the HIV activism. the HIV advocacy really moved the needle, and that is really what contributed to the, and you are in that space. You are at the global space. What do you think in sharing us? What do you think the hepatitis advocacy group, where are we getting it wrong, if I should put it that way? That is a thing of concern. I know Leanne, I know all the advocates in the room, but what are we probably getting wrong in advocacy or sharing story that we're not, hepatitis not getting the attention it deserves? 1.2 million deaths, 31 life going after every 30 seconds, the leading cause of liver cancer, and yet there's nothing in terms of funding. So, but Anton, in sharing your stories, what do you think we could do differently in driving advocacy for hepatitis elimination? Thank you.
Thanks. It's a so interesting question, and let me start from answering this question, and then I go to my story. I think it's not that the hepatitis community doing something wrong. It's rather just we should be more mobilized, organized, but it's always a matter of how community activists or advocates are meaningfully involved in the decision-making processes which are influencing or impacting their lives. You know, that's where HIV community, of course, showed quite a good example. And, you know, we know these different types of mechanism, like country coordination mechanisms, the Global Fund, or other types. I think that's where exactly hepatitis should be raised more and more, and I will also reflect about it in my speech. So, as I said in my introduction, I'm a person from Ukraine. I was born in 1980, so my teenage age, it was mid-90s, like in certain sense, quite a typical story for a teenager of that period of life of my country. So you know that since 1919, after like Soviet Union destroy Iron Curtain fall, and you know, all these countries open markets and new entertainments, new substances, I mean psychoactive substances appeared. And of course, we as young people trying to experiment, you know, it's exactly that age of when you really want to experiment with many different things. But of course, no any proper, you know, kind of information or specific services to support proper, less harmful use of substances. So that's why in 2003, I've been diagnosed with HIV because I switched from non-injecting to injecting drug use at a certain point. And yeah, though formally so-called harm reduction programs appeared somewhere in the late 90s, but it was so limited access, and only when such a big donors like Global Fund, for instance, entering the country, and they can really scale up such a life-saving services. So people like me finally got access to that, and actually that was really my my gate or my entrance to, let's say, my other another stage of my life. So of course I've been diagnosed HIV and hepatitis C at the same time on the rapid test, and to say that I've been shocked, it's to say nothing. And of course it's like you already the only question is how soon, how much time do I still have, like how soon will I die? Yeah, now I can say it with humor, but of course at that time it was really shocking and stressful, like the end of your life. And yes, that was a time like 20 years ago when treatment for HIV was still limited, and you should still wait for until your CD4 cells drops less than 200. So your immune system already almost, you know, losing track, and only then you can be considered to receive this life-saving pill. So I remember that time. And of course, at the same time, about hepatitis C, there was completely nothing. I mean, even though like it was always a challenge, like between hepatitis and HIV, because in certain sense, HIV was so terrible, so big issue, then sometimes people didn't realize that hepatitis is not less issue. I mean, it's even more contagious disease. It's even more, let's say, risky in certain sense in the long-term perspective. I mean, and if you don't do anything with it, right? So, but somehow it was always like a poor sister, you know, that, okay, HIV, treatment, advocacy, but when you're asking, okay, when finally I find, you know, there came a moment when I asked about some treatment of hepatitis C, the only answer I heard from my doctor infectionist, she said, yeah, there is like around 15,000 cost to these interferons and ribavirin, but I mean, as we said, it's amount like you have to sell your kidney to treat your liver. So of course, at that time, as a person who used drugs, I didn't have, I couldn't even imagine such a huge money. And yeah, and then you just go away from and just, you know, just keep living with that. So I lived with the hepatitis finally 13 years until finally such a revolutionary things like a direct-acting antivirals appears and a completely new era in the advocacy and even about in the dialogue between community, patients, and pharma industry. And that's actually also part of the organization where I'm working now, European AIDS Treatment Group. And we as a patient-led, community-led organization, which represents the diversity of 2.3 million of people living with or affected by HIV and co-infections in WHO European region, we were really one of the organizations kind of developing, establishing European community advisory boards, and of course, besides HIV agenda, we at a certain point we of course started this using these CAB platforms for interaction and dialogues and influence advocacy on industry regarding Hep C or Hep B or viral hepatitis treatment. Yeah, so that's just to say that first of all, the key condition, like we should really not disvalue the hepatitis in comparison with HIV for sure. And I'm really glad to know that finally this powerful advocacy, and this is Danjuma, what hepatitis community really did right. So I mean, we reached that point when, for instance, big donors like Global Fund finally changing their policies and starting to cover treatment not only for co-infected people, HIV and hepatitis C, for instance, within Global Fund programs, but also people who use drugs, but only with mono-infection with hepatitis. So that's good, and they're really changing this policy. And I'm really welcoming recent first ever donor mobilization conference, which took place 17th of May in Geneva. You know, we know a lot about Global Fund replenishment, you know, and collection of billions of funds for HIV, tuberculosis, and malaria. But again, for me, it was always, as I said, question why hepatitis is like a poor sister, though it is a part of sustainable development goals and intentions to fight this disease similarly to HIV or TB. So why the situation is so different? So I'm really welcoming that this step has been done. Of course, I would expect maybe much more funds to be collected, but anyway, this was really important step which opened really new horizons for us, and also I've been asked to reflect a bit about this WHO global health strategy and guidelines on key populations and HIV, viral hepatitis, and STIs. You know what I'm always saying, first of all, of course, I'm glad that finally, communities' voice are included and we can contribute to such documents. So I'm glad to say that the International Network of People Who Use Drugs, we contributed to these guidelines as well. And I know that other representatives of HIV or viral hepatitis communities, their voice or their vision is included. But the issue of all these documents, no matter how brilliant they are written, no matter how amazing their design, they all have only recommendational status when it's coming to the level of member states and to the national policies. And
1 minute, Anton.
Yeah. I'm finished. And it's always the question then how then country government responsibility in country, how they starting to implement to take this responsibility with the proper funding, with providing proper access to diagnostics, treatment, care of people with hepatitis. So I'm glad to see that some countries, like my country, Ukraine, for instance, we have also united, integrated a national strategy on HIV, TB, and viral hepatitis. So all the three issues are really dealing together. Yeah, and this is really good sign, like politically good sign. But as I said on this conference, donors conference in Geneva, you know, after Michel Kazachkin said, today we have all necessary tools like diagnostic, modern treatments, you know, everything. And I said, yes, we have it, but why we are still not there with access to every single person needs this life-saving treatment, needs these diagnostics. We're really not waiting, as you can see on as our motto today. We're really not waiting, and it's really a matter of our all collaborative efforts, and we really don't have a time. Every day we're losing our friends, our relatives, our colleagues. We're not waiting. That's true. Thanks.
Thank you, Anton. You are bringing so much very rich, very rich perspective into this discussion. And to quote you, Anton, you said something about it's very important for hepatitis advocates to be involved in decision making, to be in that space. I think that is a very important point you've raised, and that is what we are asking for. And I'm glad you are also there. And you're probably also in that space where you could also advocate, and we need to get more people. And it may interest you to know, Anton, that we have people that really literally have to sell their kidney to save their liver. I mean, people have to literally, like you at least you said, you are in a situation where do you want to sell your kidney to save your liver? We have situations where people sell, where hepatitis treatment has sent people to catastrophic poverty because of out-of-pocket cost in LMICs. So thank you. When we go into maybe the question and answers, we have more discussions on this. So we go on to David Urich to share his perspective on healthcare worker and hepatitis advocate. David, the floor is yours. Thank you.
Thank you, Danjuma. Good to see you again. And thank you to the previous speakers. Some really good topics have been brought up so far. I'm going to divulge a little bit into the mental health portion of what we patients with lived experience go through when we're diagnosed and then living with this disease. I think Leanne made a really good statement earlier. We as lived experience and patient community, when we come together, we do create this web of bravery and support that is, it's hard to define, but it's very easy to feel when it's there. And just to rewind a little bit. So I was born with hepatitis B. I was adopted out of South Korea at a very early age to parents in the United States, Michigan. Now they were aware of my hepatitis B status, and I was raised without that knowledge until I was 13 years old. I was transitioning from middle school into high school, very important time for young people in the States. And I was taken to the clinic at our local hospital, the University of Michigan, one day. And I was diagnosed with hepatitis B as a 13-year-old. And back then, the type of information you as a patient were given in an office setting like that was the serious parts of the disease. And we all know the likelihood of having something like liver cancer happen if you're on treatment. But back then, to me in that room, it felt like a guarantee. And after this diagnosis, 6 months later, I was in high school and I attempted suicide before a major band concert that I was participating in. And it wasn't because of my playing trumpet, I'll tell you that. It was because of all the fears and all the questions that being diagnosed with hepatitis B at any age, but especially 13, gave me. I had plans to, for a career, I had plans to really, figure out, hey, do I want a family? What is life about for me? And after that day, it changed and my life was put on hold for quite some time. As patients, we're, when diagnosed, most of the time we're told that we're going to have a monitoring type relationship with our hepatologist or gastro. And as a patient, at any age, it's very hard to hear that your life is essentially being curated until something devastating happens to where you have to be in the hospital for a while. That was the impression I was under for so many years. And through my teens, I was put in therapy, put on multiple mental health medications. Unfortunately, the therapy I was in, we weren't targeting the core issue of what was really causing me so much distress through my adolescence, which was the fact that I was living with this chronic illness. And I had talked about some of the broad strokes of it, but there's so much more that comes with living with the disease than just the symptoms of it, especially when it's communicable. So as a young person, you know, I didn't have a community to talk to. You know, I asked as many questions as I could that initial diagnostic visit, but as a 13-year-old, you're not wanting to talk about a disease like this with your friends. You're not wanting to even talk about a disease like this with your family, because most of my family members, in my mind, would not have been able to understand what was going on with me. So I held it all in, and the fears inside build when you do things like that. We as patients, we have so much power in us, but unfortunately, unless we are able to express what's bothering us and express our concerns about the illness, we can never really access that power that we all have within us. You know, and this was a long journey for me to really discover what it meant to be an advocate, first for myself as a patient, but then to understand that there's a broader community out there with other people that are suffering like I might have when I was younger, or might be suffering in different ways that can be addressed if we all provide our voices, and those voices become louder over time. Because really, in my early 20s, I turned to injection drugs for quite some time, just trying to self-medicate in a way to where I understood where all this pain and anger was coming from within myself, and feeling like I was ineffectively doing anything about it, because I would skip years and years and years of liver function tests and not talk to my doctors for 4 years at a time, and then, you know, wonder why I was so distressed whenever I went to a doctor's visit. And you know, finally, around my late 20s, I had kind of just had a few things line up for me in my life go pretty well, and I was in therapy with a great therapist. I was seeking out my birth mother from South Korea, who I did end up getting in contact with, and discovering that she has hepatitis B as well. So it's confirmed that was how I got it. But I was browsing Facebook, of all places, one day, and this was after a liver biopsy and kind of the start of the more treatment phase of my living with hepatitis B. I saw a video from the Hepatitis B Foundation from the States, and this was a woman, you know, in her late 30s, just talking about what her life was before her diagnosis, what her life was during it, and then what her life has looked like after. And, you know, as simple as it is, just seeing another person living their life with this disease, seeing that her life's not defined by it, all the possibilities of the world were still there. It was really, really, really life-changing. I haven't had many moments in my life where I can point to where I didn't really know where I was after watching it. I just knew I was sitting in my chair for what seemed to be over a half hour, crying and just trying to compose myself and really figure out what this strong emotion I was feeling was. And what it turned out to be was just this gratitude, relief, whatever you want to call it, just knowing that there are more people out there that have gone through similar experiences and have had the bravery and courage to share those experiences. That activated something in me. And, you know, it might have been there all along, but I needed that right set of circumstances to kind of bring it out of me. And ever since that watching of the video, I've kind of just tried to immerse myself in this community of advocacy. Hepatitis B Foundation got in contact with me throughout my several experiences with them doing either webinars or speaking roles. The World Hepatitis Alliance got wind of some stuff I was doing, and I've worked with them several times since that initial kind of start in my advocacy, which was in 2019. And I've kind of taken an approach as an advocate of showing snippets of my life as like just living as a patient, even having nothing to do with hepatitis. I do a lot of rollerblading, and I like to zoom around and do tricks and jump around. And I just recently did a shared little snippet of that with the WHA, and kind of just showing that like yes, we're patients, and yes, we advocate for this community to have the results that we all deserve and are available for us if there was just political will for it. And just showing that we all have our personal lives too, and we all like to have fun or challenge ourselves in other ways, and that it's not a death sentence to have this. It's you can achieve your dreams, you can enjoy what you love in this world. And I think that by showing that, I might be able to get a few more Davids to come up and introduce themselves. That's what I'm hoping, at least.
Oh, thank you, David. Each time you share your story, you bring in a different perspective I've probably not heard before. And thank you so much for being so generous to share your story, David. You're such a fascinating, great advocate. And you know, what you said is what we experience. No community to talk to at a point. The fears, of the future, what the future looks like. Thank you so much. Thank you for being so generous to share your story. We go on to the next speaker, Shabana. Thank you, to share your perspective about experiences of diagnosis of hepatitis C. Thank you.
Thank you, Danjuma, and everybody else for this opportunity. Basically, I'd been ill for a number of years, and I had thinking about it and hearing David's story, it's brought obviously tears to my eyes, and the experience that I went through is very similar to his as well. So hats off to you, David, for sharing it. When I was diagnosed, I was going through a very difficult patch in my life. I have 5 children, and I was going through a very messy divorce at the time due to domestic violence at home. So obviously I was at the doctor's every other day. I'd been taking antidepressants for a number of years because of the situation I was in. And I just approached my GP one day saying that, I don't feel like it's myself. I'm taking my anger and aggression out on the children, and then going into my bedroom, sitting in a corner and crying hours on end, thinking, why am I doing this? It's nothing to do with the children, the situation I'm in. So psychologically, you could say I was in a very dark place. I went to the GP and I said, please sort something out for me. I don't want to be like this any longer. So what we call here in the UK are like MOT tests that you go on an annual basis, if just like regular checkups. I went for mine and the results came back and he said, there's nothing wrong with you. And I basically said to my GP, I go, do you know what? It's like every hair on my body hurts. I can't sleep. I've got stomach cramps. I've got cranky mood swings. I have flu-like symptoms. And he said that, but there's nothing wrong with you. It's more than likely it's all in your head. And I said, how can it be in my head when I can feel it in my body? He did further testing and they came back negative as well, because I insisted, go test me again. When they came back negative, I basically said to him, is there anything that you haven't tested me for? And he said, I haven't tested you for HIV and hepatitis. And I said, well, why not? And he said, well, you belong to a very respected Asian family and I didn't want to offend you. I said, listen, I have traveled abroad. I have had children abroad. One's been born in Karachi and the other one in Saudi Arabia. I know where I've been, but I can't guarantee where my husband's been because I was his 3rd wife at the time. So I said, well, I could have picked up anything. And I think at the time, HIV, and we're talking about 2003, 2004, when I was actually then diagnosed. HIV was very big in the news. And I was scared. I go, maybe I've got HIV, to be honest. He tested me for both then after my insistence, and the HIV test came back negative. He said, but you've got hepatitis C. And I basically said, well, that's nothing. You can cure that. And he said, actually, no. I go, well, why not? I go, I've read about hepatitis because my background is in beauty and holistic therapies. Obviously, we do your anatomy and physiology whilst doing that. And in textbooks, it was like hepatitis A, hepatitis B, non-A and non-B. He said, well, the non-A and non-B, when I mentioned it to him, is now called C. So this is what you have. And I go, well, what's the treatment? He goes, it's chemotherapy. And at that point, it was like, I can't explain, it's like my world had ended. It just stopped. I thought, oh my God, am I going to die? Are you telling me I've got cancer? Because chemotherapy is the treatment for cancer. And he said, to be honest, all I know, it affects your liver. And can you please go in? I'm going to refer you to the hospital, to the specialist and the nurses. But when you come back, bring me some information back. And I'd really appreciate it. So when I went into the hospital, obviously, first of all, they didn't scan in those days. You had to do a liver biopsy. And from the liver biopsy, which was quite painful, they actually were able to determine that I'd had the virus for 15 to 20 years. And I had a genotype 3. And they said to me, there's 50 to, I think, 70% success rate with the treatment, which was interferon and ribavirin. And they go, we'll put you on 6 months and hopefully you'll clear the virus. And I thought, honestly, with that treatment, I thought this is going to be death sentence. I came home and cried. I cried so much. I thought, well, this is it. What my kid's going to do without me? You know, I was separated from their father. I was bringing the kids up as a lone parent at that time. Excuse me. And so basically, after that happened, I did something that was well out of character. I was watching TV that night that I was actually diagnosed and had the talk with my nurse. I came home and majority, well, UK based would know that there used to be a program on TV called Teletext and you could book holidays through that. I just clicked on a button and I booked a holiday to Istanbul. And that was third day in the hotel room, sat on my bed. I'm thinking, Shabana, what the hell have you done? You have never left home without asking or telling anybody or notifying anybody, be it my brothers, be it my brother or my family. And I'm sat here in a hotel room. What on earth am I supposed to do? Anyway, the third day went by. Sorry, the fourth day came by. And my sister called me and I lied. She goes, where are you? And I said, oh, I'm in London, because as I mentioned earlier, I had a beauty company, so I did a lot of traveling. And I said, oh, I'm in London with a client. Oh, okay, when are you back? I'll go in a couple of days' time. She says, fine. The day after, on the 5th day, my brother called and he said to me, sis, where are you? He goes, don't lie. It's an international tone. Yeah, so I know you're abroad. I told him the basics. Basically, I go, I'm here and I'm going to be here for another 15 days and I'll return. He goes, let me know when you get back home. I spent my time in the Blue Mosque just praying. And I just prayed so much. And I said pray to Allah. And I said, basically, I go, God, please give me a new lease of life because this treatment works. And I pray with every breath I take, I go, I will help save lives. I came back very determined that I was going to be hepatitis C, underwent the treatment, which wasn't a nice treatment. Of those of you that have been on interferon will know. 3rd month, mouth ulcers, stomach ulcers. I hadn't told my family because the situation was as such that I thought to myself, if I go to my family, they're going to be thinking I'm sympathy seeking because I'm going for a divorce. So I couldn't approach them. So I told my nurse what I was going through and she insisted that I bring my mother and sister in, which I did. And so they were educated and they said, when I came home with them, my brother turned around when he found out, he said, where have you been to have caught it? I'm being born in this country and being brought up, never done drugs, never had a boyfriend, never belonged to a very conservative family, had a massive reputation in the community here, still do. So it was like more of the social aspect that was affecting, you know, that I couldn't talk about Hep C. And when I asked my mother again, I go, why can't I talk about it? Finger in lips, she says, you can't talk about it because everybody, almost everybody in Pakistan has it and it's as common as water. And I said, but Mom, it's not through water. She says, no, it's passed on from husband to wife. So you may have caught it from your husband, right? And to talk about that is disrespectful in our community and I don't want you to do it. So obviously I had to educate the family a lot, and they now, present day, they are now advocates as well, and they raise a lot of awareness regarding hepatitis C within the community. But basically, when I actually started treatment, as I mentioned, 6-month treatment, and that started in 2005, I'd held it off because I'd asked my nurse to take me to a support group so I could witness how people felt undergoing the treatment, because I thought, I'm a mother of 5 young kids. How on earth am I supposed to look after them undergoing chemotherapy without any family support? I saw one of the ladies there that actually couldn't even lift a teaspoon, and that really scared me. So I went to a friend of mine who was doing a course on homeopathic medication, and I went on a 6-month break from the treatment before I started treatment to do that. And my nurse used to call me. She goes, "Where are you?" I go, "I'm on the motorway. I'm fine. I don't have hepatitis." She says, "No, you still need to come in." I did the treatment. I completed the treatment.
So, Shabana, you have 1 minute left.
Okay, thank you. I completed the treatment, and basically I started then working with the Hepatitis C Trust. I cleared the virus, started working with the Hep C Trust as a volunteer, and I joined the Hep C Trust then in 2009. We did a lot of campaigns regarding hepatitis C within the South Asian population, and I've worked on so many campaigns, doing media work, doing TV work, interviews. We developed information on CDs for people that couldn't read and write Urdu itself. Then of late, we actually developed a film on hepatitis B and C, which we have now a QR code for as well. I've been with the trust 12 years, and then I've been with the trust 12 years, and then as a part-time worker. But then a year and a half, almost 2 years now, in November, it will be that I've been working on a new project full-time. And we discovered after COVID that a lot of people were trying to access healthcare, but miscommunication was mentioned. People thought that it was passed on A to B, B to C. During that time, I'd visited Pakistan with my nurse as well, and it was a fact-finding mission from Karachi, Lahore. We traveled all the way up to Gilgit. We met people. Transmission routes were highlighted. There were a family that came to see me thinking we had a miracle cure for hepatitis C, and it was like 6 brothers from Gujarat who had all caught it through being tested for a blood type, as they were going to donate to a blood for their brother. Sorry, I'll finish here. So we came up with a lot of transmission routes which were highlighted, and then we talked about it with the community. We are now, I was one person working for so many years, 3 of us now covering the whole country, and we cover a lot of South Asian events covering mosques, Hindu temples, Sikh temples as well. And so basically we've tested, from the program start, we've tested about over 1,800 people and seen a lot of people go through treatment as well. We work with operation delivery networks, we go into prisons, we work with the community teams with the Hep C Trust. So we're raising a lot of awareness, but we're still coming up against a lot of stigma as well. So I think my final words will be, I think what we found is working with different agencies. If somebody is coming to an event and there's different agencies there, it kind of destigmatizes the issue regarding talking about hepatitis C. So if people are testing for diabetes, oh, come and get a test for Hep C as well. So that's really working for us in the community. Thank you for this opportunity.
Thank you, Shabana. Quite interesting story. And thank you for being so generous to share your story with us. And congratulations and thank you for the great work you're doing. And so thank you. We go on to Bartholomew Joshua for your story. Thank you. I think you're muted. Okay, thank you.
Hello everyone again. It's very interesting to hear the different story from my co-patient and the challenges they're facing. My story is almost aligned to those. Actually, I dreaming to be a nurse. I enrolled nursing course, and I was diagnosed in 2005 when we had this screening prior to our hospital internship. I took the DNA test after my screening, and visited a doctor. The doctor said, he simply told me that I will only have 20 years to live because after that, my hepatitis B is going to become a liver cancer. He said that liver cancer has a high mortality rate, and no, he doesn't give me no medicines prescribed, no other laboratory requested. The consultation between me and that doctor ended that way. I'm worried, and I question, where did I get my hepatitis B? So I went home and I told my parents about the result. Their initial reaction is to separate me from them. They separated my utensils and my other things. They did not let me eat before them. Discrimination from your family hurts a lot, plus the discrimination from your friends and your community. However, I convinced them because I'm very curious where did I get this hepatitis B. I convinced them to be tested, and sadly, three of my other siblings were also positive. Because of the challenges of the limitation of support from the government here in the Philippines, expensive laboratories, we decided to uh, just keep it in the family. So to prevent my brother and sister from experiencing the discrimination I had experienced. So we continue our life like that and until I graduated in college. But sadly, because of the employment here in the Philippines, the discrimination and stigma, and there is no law protecting the hepatitis B patient when it comes to employment. My dream to at least practice my course here in the Philippines um, is not possible. So in 13 years, it's just in 13 years, it's just keep like that. So until I feel that I need to take action. In 2018, that was 2018 when I found the community of hepatitis B. I found the Yellow Warrior Society Philippines, and I was given a chance to attend their team building, given a chance to attend seminars and workshops. And also, in the Yellow Warriors Society Philippines, I was given a chance to join and study in early detection of liver cancer. I found out that developing a liver cancer is just a chance, but not fate for those having a hepatitis B. This gave me a lot of courage also. This gave me a chance to serve uh, my and so I decided to be an advocate to disseminate the right information, to work in a different organization, to have direct involvement in the program, to promote collaborative project and increase community engagement. And of course, the most important part of being an advocate of the community is to empower my co-patients to become a champion. And gladly, we had already program here in the Philippines, but in selected municipality. But it's nice to hear that little by little we can have those programs that may increase the awareness of the people around us. So I hope everyone will. I hope everyone, because I believe that through this collaboration we can make a huge difference. So the only problem we are dealing with is the funding, of course, and let's help each other for our same goal. Thank you.
Thank you, Joshua. Thank you so very much. Quite interesting story. So, folks, colleagues, and friends, we are opening up to discussions, question and answers. And we have quite a few interesting questions. Some people have dropped in the question chart, and though I responded to one, he asking about what is the treatment pipelines? Are there funding for treatments? And is the treatment for now only functional cure? After with your experience in vaccination and with the scientific background, what can you say in terms of the drive towards functional cure? Aftab?
Well, thank you very much. Actually, there is a challenge with hepatitis C. We yet don't have a vaccine for hepatitis C because of the nature of the virus. The RNA virus, unfortunately, they mutate a lot. That's why we can't have a conserved region for which we can have a better vaccine. But for hepatitis B vaccines, that's available since long, since 1980s. There is a vaccine available. There is a lot of modification in those vaccines, so we can make it more effective. So for hepatitis B, we have a very effective vaccine, and everybody should go for it. And even in Pakistan, there is a national program for the vaccination. So every child who is born in Pakistan that is being vaccinated for hepatitis B. So for hepatitis B is the vaccine is there and it's very effective. But the treatment yet, there are now antivirals, they are there into the market, but their effectiveness is not that much as compared to we go for hepatitis C. So as I mentioned earlier, like if we talk about Swaldi, which was quite available in most of the developing world, there was a program in most of the developing world where Swaldi was made available for treatment of hepatitis C. So that is there, and it was also functioning in Pakistan. So the government is providing a free treatment for hepatitis C in Pakistan. Then Epclusa came that it was even more effective than the Swaldi. So for hepatitis C, the treatment is quite effective, but for hepatitis B, yet there are a number of antivirals that are available in the market, but still the cure rate is not that high as compared to hepatitis C. So that's a story. But now the scientists are working if there is a fibrosis or if there is other ailment. So now it's the era of regenerative medicine. I'm also actively working in area of regenerative medicine. So that's another way that how we can use the regenerative medicine, and we can regenerate. Although the liver that has quite a potential for regeneration. So we are also the other. I missed one of the story, and that was if you get a hepatitis and your liver is fibrotic, so what you can do? One option is liver transplantation. So in that case, you have to get piece of the liver from a donor who is matched with you, and you can get the piece of liver into your body. There's the liver transplantation. That's quite a tough procedure.
All right, thank you.
But now, sorry, so that's very quickly. So now we have more focus being I was trained in tissue engineering from Japan. So now we are focusing that how we can make a piece of liver from the patient own cell in the laboratory. So there is no need of getting from the donor. Rather, we can do the cells from the patient, and we can prepare piece of the liver in the laboratory, and we can do the transplantation.
All right, thank you, Aftab. So maybe just to add the perspective about hepatitis B treatment, currently the WHO is working towards launching out the hepatitis B treatment guidelines, and very soon, hopefully, maybe in the next few months, the new guidelines will be out, and the guidelines really is going to simplify and expand eligibility for treatment. Before now, the treatment guidelines was looking at liver disease, right? But hopefully, the eligibility is going to be expanded, and more people, over 40% of people that were not eligible for treatment, will be on treatment, hopefully, with the new guidelines we're looking forward to. So the challenge about hepatitis B, as we know, is that it goes into the genome of the cell and the cccDNA. That's what makes cure for now literally impossible and difficult. But there's an effective treatment using the nukes, the nucleotide analog, which is tenofovir and entecavir and other treatments. But for now, it is mostly live. So the treatment eligibility with the new guidelines is going to be more simplified. And the thought is that there should be more care at the secondary and primary level of care. And that will now drive me to go to Lien. Lien, what is your experience on improving engagement in care and treatment of people living with hepatitis in primary care. Leanne.
Yeah, thanks, Danjuma. So that's actually the one of the research that we are doing. I'm doing here as part of my research hat in Melbourne, Australia. So we looked at the current situation of hepatitis B care and treatment in primary care, and for Australia, only around more than 10% of treatments are provided in primary care. But then when it comes to any type of engagement in care, for example, having HPV DNA ordered, or having an ultrasound order, so that can be up to 50% of people that have any engagement with primary care for their Hep B care. So what we saw, like, which is a really not a good thing, is that so when we looked at the data set of more than 500 primary care practices here in Victoria, Australia, we found out that out of those with a hepatitis B diagnosis noted in their medical record, only half of them are engaged in care. So that means that actually in primary care, even so, like 5 out of 10 people who has a note of them living with Hep B are not receiving care. So we were also trying to see what the reason and what can be improved to do that. So I guess firstly, it is also the restrictive nature of primary care in Australia to be able to prescribe treatment for people. So that's also a limiting factor as well. But there's also, we also interview people living with hepatitis B here, and found out that there are all actually other factors that restricting their access to care for Hep B care and primary care. First thing is around the trust in primary care. So people thinking that they need to receive specialist care and do not think that primary care is good enough for their condition. So I think that's one thing that we need to improve the awareness and understanding of community that they can actually receive care in primary care. And secondly is that it's just like the way of the health system is set up. So if someone is seeing a specialist in hospital for their Hep B, they will not incur any out-of-pocket. But if they see a doctor in primary care, there's also the way that they incur out-of-pocket. So it is actually a disabling factors as well. So I guess when we, if we want to look at improving access to primary care, which I think the only way that we can significantly improve the engagement in care and treatment for people, because specialist care is not that available. And thinking about, I think globally, only 10% of people living with Hep B are diagnosed. So if like the other 90%, they will not be able to get diagnosis and then care and treatment in specialist care. So primary care is the way to go. So I guess we need to improve, improve the collaborative approach to share care between primary care and tertiary care, to improve the care quality, also the trust of community to the care that they are receiving. And also we need to work together, like to work with the system to make sure that we can remove all the financial barriers for people so they can be more comfortable seeking care in primary care. There's a lot of other things, and I think I will not have enough time to talk about that today, but would love to be able to share more of what our findings are, and then what can be done from both system, health professional, and community perspective in improving that.
Thank you, Leanne. Thank you for sharing that. Is Anton here? I would want to draw a question maybe to the panel or to Anton. Anton, you share very good perspective about the HIV and hepatitis. And I can really imagine at the time when hepatitis C was pegylated-based interferon treatment, and there were no options for DAAs, and then the HIV trauma and all those things. So someone is asking that it is time to raise the issue of financing elimination. Beck Bollard, financing elimination of hepatitis at global level. What needs to be done in order for the global fund to pay attention to the problem of hepatitis? This is today's challenge. Well, let me quickly say this. Yes, we've gotten global fund to include hepatitis into the funding stream, but Anton, it might interest you to know, I don't know the experience in other countries, but I don't know what the hepatitis advocates' experiences are, but from the few countries we have received, Anton, there were quite some resistance. There were quite some resistance to say, this is our space, this is not resources we could share. So that is a big challenge to hepatitis advocates around the world. So what do you think we need to do to strengthen the voice of advocacy for financial resource mobilization? Anton?
Yeah, I'm here. I think it's very in line with my point about WHO global strategies on HIV, hepatitis, and STIs. And actually, since it's one of the arguments, because of course member states who voted for this document, and actually they have some certain political responsibility for implementation, as well as just orienting on these sustainable development goals, where it's also part of the issue. My very concrete recommendation, especially like for countries like Kyrgyzstan, the Global Fund implementing countries, since we know that Global Fund is really, they really changed their policies. In every Global Fund implementing country, there is so-called CCM, country coordination mechanism. Usually, it can be either on the cabinet of ministers, like advisory body, which making the decisions regarding the use, development of the program, country proposal, implementation, monitoring of the program, and the key issue is key condition is decision making on use of these funds. So, in the composition of all CCM, there is a very concrete recommendations from the Global Fund to have representatives of all populations and communities. So there is traditionally seats for people living with HIV. Also, we advocated recently, and there are separate seats, or used to be separate seats, for people who use drugs, sex workers, men having sex with men, transgender people, prisoners, etc., etc. I really never seen any separate seat for people with lived experience of hepatitis C or representative.
What can we do, Anton? Do we need to talk to Global Fund at the global level? Because we started this discussion as WHA. Yeah. And remember discussing with Kerry, we had this discussion, and we're asking, what could we do? What can we do to get people at the decision making? So do we talk at the global level?
Yeah, it's two sides of this question. One is the Global Fund itself, and of course they can use their political wage, let's say, to influence from their side in their talking conversation with governments, etc., etc. But of course, Global Fund keeps this principle of so-called country ownership. So of course they leave it to certain extent to as internal decision on the country level. So it's a matter for advocates and activists in this country just to send specific official requests based on the recommendations of Global Fund, based on the recommendation of WHO, based on these obligations under the even new political declaration of high-level meetings, and we know that there are three high-level meetings at September on UHC, universal health coverage, tuberculosis, and PPPR, pandemic prevention, preparedness, and response. And I'm pretty sure that hepatitis, of course, will be also there, or must be there. So referring to all these documents, especially if also countries signed certain joint strategy on HIV and viral hepatitis, it's a must to have a separate seat for this constituency, for representative of hepatitis community. And then you have a voice, and then you have a vote. And of course, then it's a matter of, bringing allies together. By default, we all HIV-affected communities, we are all overlapping with hepatitis, TB. So we always we're always moving together a certain joint, army of activists or advocates. So it's just a matter of, pressure from both sides, I guess.
Absolutely. Thank you, Anton. I'm afraid we're so behind time. So just one statement from each one. Shabana, just one phrase. What would you say about World Hepatitis Day 2023? Your last call.
I think I'd like to say that it's extremely important to have information, correct information for the communities so that they can actually engage and understand what's happening, and then they can get treated as well.
Thank you, Shabana. Aftab, one phrase, one statement.
Well, I think the policymakers, they should be sensitized. So there should be a national campaign for better awareness as well as treatment.
David?
I think there should be a large conversation with cure that we all need to take care of our mental health alongside that.
Joshua?
I think for the patients, they have to take action and to start to take action and not wait don't wait to act from the others.
Thank you. Lien?
I guess we will always need to remember that there's still 90% of people living with Hep B have not been diagnosed, not knowing that they are living with that. So yeah, find the missing millions. I still want to go back to our theme many years ago, but I think it's still valid.
Thank you. Anton, last word from you. Anton?
Yeah, sorry.
Last call. Your last call. What will be your last call on World Hepatitis Day 2023?
My last call is, stop tokenism, turn to action. That's the thing.
Thank you. So thank you all for this beautiful webinar. I'm super grateful to all of you as the panel members and all colleagues, friends that have joined the call. You stayed all through since the start to the end. I'm super grateful for the opportunity to share. And I want to say that hepatitis can't wait. We have over 350 million people living with this disease. We need to diagnose more. We need to treat more. We need to test more. And like Leanne said, and like every other panelist member here said, we need to do linkages from primary care to secondary care to all levels of care. We need to do more. Anton said it rightly, we need to speak out more. David said it, mental health. Shabana, yes, about cultural norms that affected you to really speak up. And Aftab, yes, we need to. So we need more voices. We need collective action, collective, not just voice. We shouldn't just sit and speak to ourselves, singing to the converted, but we need to go out there to raise awareness. Please plan your activities, raise awareness. Our website, the World Hepatitis Alliance, we have information, we have flyers, download them, share them, raise awareness about this. Let's make noise about hepatitis. We could save life. Just an information from you could save life somewhere, and ensure that the people we give information to should be screened, should be vaccinated, those who are negative. Those that are screened should be linked to care, and we need to retain people in care. So on behalf of the World Hepatitis Alliance team, Tajinda, with the communications, Tobilola, all the guys in WHO HQ in London, I want to sincerely thank you all for being part of this 2023 community forum. And I look forward to getting the feedback from all of you with all your activities towards World Hepatitis Day. So thank you and goodbye from all of us here. Thank you and bye-bye.